Hopefully you're going to leave here tonight with some new ideas and some excitement about your future and about your city. As Pamela said, Knoxville is a wonderful community. We got a chance to tour it a little bit today, and there's some really fascinating and great things going on here. The format tonight will have 3 blocks of documentaries. The facilitated discussion will happen after the first 2. The third block will just be, not just be, but it will be Jeff Welch talking about smart cities. But we will not have an extended facilitated discussion. So our first block of films is going to focus on transportation planning, and it specifically looks at some of the challenges and solutions to making our transportation system support healthier, happier lifestyles, hence part of the name. The second block of documentaries is going to focus more on land use policies and zoning and parking codes and things like that, but it's interesting. And this is important because these things really influence the places that our streets connect us to, and so that we can use them in whatever mode we choose and support our healthy lifestyle. So I said the third block, it's not a block, it's going to be one documentary, but it's a little bit of a teaser or an introduction, if you will. If you're not familiar with smart cities, you'll be a little bit more familiar with it after that, and then Jeff will follow with some comments. So tonight it's my pleasure to introduce to you our peer experts for the discussion tonight. FHWA and FTA have provided support for these folks to be here with us, and it's my pleasure to announce that Philip Ericsson, who is the president of Community Design and Architecture, a city planning and urban design firm based in Oakland, California. Phil is a planner, an urban designer, and an architect with an extensive experience in community and urban design, land use, and transportation planning. Phil has worked with urban, suburban, and rural communities to help them transform their streets and places through planning and design and policy to support walking, biking, and transit use. He's authored national standards for the integration of street design, land use planning, and urban stormwater management. David Vega-Barachowitz is a senior urban designer with the New York City Department of City Planning. And David has led the development of an innovative National Association of City Transportation Officials, NACTO, street design guidelines to promote walking and bicycling as the director of the Designing Cities Initiative at NACTO. He co-authored a book called The Startup City, Inspiring Private and Public Entrepreneurship, Getting Projects Done and Having Fun, which showcases innovative ideas that start as simple pilot projects and can grow into major improvements that support healthier, more active lifestyles. In addition to our national peers, we're lucky to have a couple of local peers joining our panel as well. For the first block, Belinda Wood, who is the Director of Communications and Service Development for the Knoxville Area Transit Authority. Belinda has received her undergraduate degree from Rhodes College in Memphis, Tennessee, and a master's degree in urban and regional planning from the University of Tennessee. As the Director of Communications and Service Development, Belinda handles marketing, media relations, overseas communications, customer service, and outreach. We also have Bill Bruce. He is the principal in charge of Knoxville office of CRJA IBI Group. And I am sorry, but I did not ask what all those initials stand for. But be assured that Bill has over 30 years of experience in community planning and design. Designing for Health, a firm he co-founded, has teamed up with CRJA IBI to develop a health design assessment, which is an innovative process that aims to improve well-being in communities and project sites through evidence-based design. So it's really our hope that you as the audience will see these documentaries and it will generate questions and ideas. We will try to hold those till the end. We will run the documentaries simultaneously. And I think with that, we can start with our first film.
I'm Phil Ericsson, out here from Oakland to be with you guys tonight and tomorrow. Should we each just go and say a little bit about sort of what we take away from this? I've been tempted ever since I've been previewing these videos that after this round we'd say, boy, those kids are right, and then we're done. But I mean, the thing to me that I think they're really right about that is increasingly been my experience in working in the area of complete streets and thinking about land use and transportation is how often we forget the fundamental element of this is being able to walk somewhere. We get all tied up in, what's the right transit network that we need? Should we have streetcars? Should we have this, that, or the other thing? Do we need to restructure things? And then we're missing that you need to create an environment where people can walk. Whether you're driving to a shopping center, can you park once and walk to all the places in the shopping center comfortably? I kind of make myself do that anyway, but we really don't always do that. To me, that's a lot of what these kids are talking about, is, at least for myself, when I was growing up in mostly suburban environments, it was an environment where there was enough of an infrastructure to it that it was safe to walk. I didn't always walk to school, but I could walk around the neighborhood and go and see my friends. And a lot of kids are growing up in places where that's just not possible anymore. But for all of these elements that we're thinking of, and I think it really, to me, it runs through the land use discussion as well, is we just don't think enough about pedestrians. And we were having some conversations beforehand, and one of the things that comes up a lot in projects that I'm working on street designs, you get into discussions with engineers and others about what are we going to do in the street, and people start talking about pedestrian amenities. And it's like, oh, okay, so it's already something that we can dispense with. If the budget gets too tight, let's get rid of the amenities first, because those don't really matter. But if you can't walk in the environment that you're in, then you really don't have the kind of mobility that we need.
I'm Belinda Wood, and I am the local perspective, Knoxville Area Transit. And I design bus routes. And so it's a really interesting challenge to design bus routes. Anybody want to try it? I'm welcome to come by. We'll talk about it. But I think piggybacking on what Phil said, I can design the most fabulous bus route ever, but if you can't get to it, then I've just wasted a lot of time and effort, right? We talk a lot about first mile, last mile. If I can get people onto one of our fabulous buses, they get on and they're like, wow, this is so much more fabulous than I had expected. Everybody kind of has their concept of what a bus looks like, but when you get on it, you realize it's really a great, pleasant experience, but it's getting to it, and it's also waiting for it. If you're waiting in a ditch, which used to be one of my bus stops that I caught the bus at, it was a little bit unnerving, and you felt like sort of a weirdo standing there in a ditch. So I think that creating that kind of pedestrian infrastructure is what's going to go a long way to making transit really successful as well. There's a lot of different elements, but I think what we'll probably all be saying is let's continue to balance those resources beyond just the roadway where the car drives to the pedestrian and the pedestrian experience. It's one thing to build a sidewalk when cars are going by 55 miles an hour and you're right next to it. So it's kind of thinking beyond that to the pedestrian experience and the transit passenger experience and the biking experience, the complete streets idea. So anyway, I could ramble on forever, but there's better experts that are going to tell you more. So.
Hi, I'm David Vega-Barachowitz from New York City's Department of City Planning. I wanted to briefly address the first film because that one really impacted me, but also just to praise this format because I think it's really important that we do embrace new forms of media as we try and communicate with the public and with ourselves. Frankly, I think that as you were telling me earlier, our attention spans have shortened over the years, and I think it's important that we do that. Before I came out here, I did a little bit of historical research on the city and came across an old plan that was done by Harlan Bartholomew, who's a name that most people, unless they're nerds like me, probably don't know, but he was one of these sort of city planning experts that went around the country and produced vaguely identical plans for pretty much every mid-sized city in the country. And one of the interesting things about these plans is that oftentimes we kind of see the parts of them that precluded, presaged the interstate highway system or showed the street widenings or the elimination of trolleys. But actually, a lot of these plans had a kind of sensitivity to the role of kids in the urban environment. And the role that children played, especially the idea of play in the street and how to actually kind of redefine the street as a place of movement as opposed to a place of play, is really something that kind of stands at the heart of a lot of our built environments planning. So this idea of having cul-de-sacs as opposed to through streets, the idea of having playgrounds within certain areas or schools located in certain areas was something that was really formative to the expansion of American cities. And many of the problems that we're today kind of trying to correct or seeing as these evils were actually very much part of the DNA of our thinking about how the built environment would expand and would become modernized. And I think that that's important because as we look at and listen to what kids are saying about our environment, I think that there's an opportunity to make that central to our planning once again. Now, the difference, of course, and this is my second point, is that giving children the tools of the planner is something that was never done in that era. And it's really amazing to see a kid actually take a pen to paper and draw what it is that they want, whether they're a skillful artist or someone that truly understands the built environment in a kind of technical way. I think that as a planning process, especially I know in New York City, is something that there are a lot of barriers to doing. And yet that kind of input and engagement is really central to how we understand the daily experience of how people are actually seeing their environments. And that needs to inform how we plan for it.
I won't be as eloquent as you, but this is so cool for me personally as a planner, landscape architect, and from Knoxville originally. We started seeing how health impacted the built environment for me personally about 6 years ago. We always design it and we always try to do cool things with trees like that, and the film was awesome on the kids. That was fantastic because a lot of those principles are things we all try to do. They say it much more eloquently. But on a larger picture way up here is 88% of what we spend on healthcare is on prevention. 4% is on, not prevention, but on wellness and fixing your body and going to the doctor, and that 4% is on prevention. 4%. Now that's ridiculous. So when you have developers or people that aren't understanding how this thing works, like in the films, to get sidewalks, we should have sidewalks everywhere. It encourages walkability. What I've learned in all of this over the last 6 or 7 years understanding this, it's how you sell it. You don't sell the trails and things as recreation, because when you have teachers' pays down or firemen or policemen need pay, you can't sell it. Sell it as economics and health. And that's really what it is. We're just not selling. Even on our state level, we're not selling it correctly. So we're seeing how these things are starting to happen. And one of the problems that I've seen is my partner in Atlanta is ex-CDC in Atlanta public health expert. So she's taught me a lot on how to look at this from so I can understand it. The health people have a different language than the design and planning people. So it's been a little bit of a hard sell to each other, in my opinion. So we're learning how to understand targeted health data and how it works in the communities. But it's fascinating to me that how it's starting to come. It took 60 years for them to prove that tobacco was going to kill you. Okay, so the health people think differently than we. So what we try to do is what's called correlations. We know that a park is going to be healthier or make the area healthier. They can't prove it, so we have to correlate. And that's coming, though, and it's on the way. But for Knoxville, and Stephanie Welch over here, and there's 2 or 3 other people that have helped me understand how Knoxville works. But it's so important to put health and economics in these things, not just, hey, this is kind of cool, or you need some trees over here because it looks good. The health data supports it, and that's what's called evidence-based design, and that's what we need to sell to the councilman or whoever is in charge of this thing. And anyway, that's a good cue for quitting. Thank you.
The video is really focused on improving health of people and everything, and that seems like any additional help is good and everything. I'm interested in knowing your guys' opinions on how transportation affects the most fragile in terms of people not even able to hold a job because they don't have cars, or not they're not able to achieve a maintainable lifestyle because they don't have the means to do it, and how community transportation can assist that. So it's just kind of an open question.
One of you?
I could give you I'll give you the Knoxville, or at least my perspective, as an urban planner and as somebody who sees how routes affect people. I think one of the things that the general public in the United States forgets is that not everybody has a car. And for those of us who see that every day, it's a reminder of how important what we do is. And there's several reasons that's important. One, you mentioned sort of a cost factor. The Plan ET project that was done here showed that in this region, 20 to 25% of average income household income goes to transportation. So, of course, and I always say, if you just buy a bus pass, you could save thousands of dollars a year and essentially give yourself a raise. So that goes a really long way if the bus route is convenient to where you work and where you live, and there's some kind of personal planning that has to be involved in that. The other thing I always talk about is seniors, of course. We've mentioned an aging population. So seniors, I believe 1 in 5 seniors, 60, I used to know all these stats, 60 and over don't drive, don't have a car, or don't drive. And then of those, there's a really significant percentage that just don't go out on a given day. And so that means isolation. It means not going to doctor's visits. And I think in rural areas, it's even more critical because those connections just really are inconvenient or don't exist very well. So we understand the very crucial role that transportation alternatives play in sort of some of the more fragile members of our society. I mean, we see it every day. And so we want to build transit service not only for them, but for the entire community, but in a way that works so that no one is left behind. So.
I'm just adding on to this. One of the things that's really important about this whole issue of income and mobility and access to healthy foods or jobs or whatever it might be, is that it's actually, it's a combined cost equation. There's a lot of research that's been put out, analysis tools to look at, and it's the combined housing and transportation cost. Because often what happens is we put people into situations, given our land use patterns and our transportation system, that they make a decision based on one or the other of those, and the reality of the other cost isn't always so clear. So typically they make the decision on housing, because that, you're paying a rent and it's very clear. If you're owning a car, you're buying gas, you're repairing the car, you're having insurance, hopefully, and those other things, but it's all dispersed and you don't really see it happening under one bill. So we've created these land use environments where it can be really difficult to have an affordable transportation system. And so some of those things that the kids were talking about, and the discussion about Houston, and the access to healthy food and access to medical services and things like that. So it's a complex question, but it's a lot of what the planners in the land use and transportation realm are thinking about, a lot more of this issue of last mile, but also trying to get the services, and some of this gets into the healthcare system and the marketplace for markets and liquor stores posing as healthy food places, which is an increasing problem in sort of my urban environment where I'm from. But this is one of the really difficult questions to deal with, and people are things are becoming more visible. There are tools that are out there that can really help people deal with these issues. But for the people who are at the lowest income levels, it is a really hard issue, and it's something that we're not really fully addressing yet, I don't think, in sort of the planning governmental realm.
Yeah, just wanted to add one quick thing to that, and I think that, the Houston video is incredibly captivating, and what Metro was able to do is an amazing success story. But the majority of transit agencies are still struggling on a route-by-route, stop-by-stop basis. And even a minor bus stop consolidation can really be challenging for a practitioner going out and facing the reality that the one person that's impacted by that bus stop moving is incredibly, that impact is outsized. I did a planning study on Youngstown, Ohio, not so long ago, and we were looking at proposals that had come forth to develop a large section of Youngstown that had been relatively undeveloped since the 1960s into a park. It's kind of a common theme in planning. If you see Detroit, all of these abandoned buildings can just be sort of torn down, and there can be a large park there. And what we kept finding, of course, in these studies was that the one person or the 10 people on a block that had stayed were not going to leave. And I think that challenge of the individual experience versus the sort of universal ideal is one that is central to the field of urban planning and urban design. And it's one that is incredibly difficult to confront and to manage on a day-to-day basis. But where success stories like Houston, where people like the bus lady have become proponents or have become champions of those ideas, it's really critical to keep them engaged and keep them active.
Question in the front.
My name is Robin Hill. I'm part of the aging population.
You get around great.
Belinda, by the way, is a truly unique person because she thoroughly enjoys designing bus routes. Now, And our hope is that someday that Belinda's organization, KET, and Dawn and Victoria, who are associates there, can get the KET district area of coverage expanded to be outside the city limits of Knoxville. That will require a political decision on the basis, on the part of the Knox County Commission. But I live in a little town, it's an incorporated town, west of here, 20 miles. It's gone from 2,500 people in 1980 to 22,600 now. We have designed the town to be walkable. We've designed it with sidewalks and walking trails, and we continue to do that. But we have to drive the interstate to get to town because everybody either goes to the T or goes to Oak Ridge or works in town, and they clog the interstate totally between 7 to 9 and 4 to 6. I think a cultural change is needed, and education is needed to make that happen, to get people to think about riding the bus. And I can ride the bus, I can drive my car to the city limits and get on the bus and come downtown in about 30 minutes on one bus. That's nice. When I lived in Birmingham, Alabama, I could go all the way to town on a streetcar. That was nice. And so I sat there and wrote on a nice piece of streetcar and read my newspaper. But we don't have that now, and we've lost it in the suburbanization of the county, which is typical of every other city in the United States. And we need to look at the structure of the transportation system, particularly the public aspects of it, mass transportation, and start planning for that. Because I noticed that when TDOT designs a road, for instance, like a 4-lane road from Knoxville to Alcoa, it's not designed to accommodate mass transportation. It's designed to accommodate cars. It's designed for a 20-year or 30-year life. Cars won't be able to do that in 20 or 30 years. So it really, you folks really need to help us plug in somehow to a cultural change to start a motion and a movement to get Knox County collectively walkable and drivable and suitable for riding a bicycle on. And we ought to want to do that. At 90 years old, I walk, I drive. I like to ride a bicycle, but I don't want to fall, so I won't do that. But I could ride my bicycle easily in Farragut. I could ride it to my fitness center 5 miles easily. But 3 of those 5 miles don't have any sidewalks, and I'm not going to ride on Kingston Pike. It's a death threat. So really, we got a big job to do, and I suppose you all are here today to help us start.
I'm going to follow up from that because I think that was a beautiful and heartfelt articulation of a lot of the problems that are faced in this community and across communities across America in terms of mobility. And I know that several of you have been working in